Hey, hello, both of you. Welcome.
Hello.
Now, just a quick for the audience as well. Do you prefer Dr. Smith, or do you prefer? Can we call you Kevin for this evening's
Yep.
conversation?
Perfect. Thank you.
All right. And Sarah, do you prefer first and last in title, or can we call you Sarah tonight?
Yes, Sarah, please. Yeah.
Perfect. Well, you both came prepared with a presentation to kind of share some of the work that you guys are doing at the Good Clinic. So we want to get that going, but we also want to encourage everybody who is in attendance to really think about, all of the work as you're sharing your presentation and the work that you have put into building the work that you're doing there at the Good Clinic. For our audience, as you're thinking about things, drop them in the chat. We will be bringing those ideas and questions forward as a part of the Q&A after the presentation. But we look forward to hearing about your work, and I'm going to pop up your presentation now. All right, make sure that that's coming through on your end.
Excellent.
Perfect. Well, the stage is yours.
All right, great. Well, I think you can go ahead and advance the slides to. So, just in general, what we really want to cover here is, what is the current state of primary care, and why is it that we thought there was an opportunity here to create a model of primary care that was unique and different, and also talk a little bit about what problems are we trying to solve, the importance of primary care. I think that's relatively non-controversial. However, we've got some data that we'd like to share with you on that point. And then, basically how we're approaching primary care and how we think it's different. Talk a little bit about how it's going. We're very much a learning organization. We're just coming up on a year from when we opened our second clinic. We now have 6 clinics, and then we want to keep this very conversational. So Sarah and I will be tag teaming, going through a few slides here, and then we'd like to open it up and have more conversation with you. All right, I think they learned about us in that last slide, so I didn't even have to say advanced slide, or I just went next. All right, we covered that. So I'm going to talk a little bit about the current state of primary care. And so in the early days of figuring out this model and trying to figure out what it is that we could do that was unique and different in primary care, we did a fair amount of research on where the problems are and where the opportunities might lie. But one of the things that it came down to, so I'll get into more details on the statistics and around the state of current primary care. But a couple things boiled to the top, and that was the experience of primary care. And so we really wanted to address the experience both for the patient, and we prefer to use the term client, but so for the client to improve that experience of primary care, understanding that the current status quo oftentimes is a less than ideal experience because of the busyness of the clinics, the quick turnarounds. Having worked as nurse practitioners in large systems, we know that you get double booked and those kinds of things. And so the experience is not ideal for the client, but it's also not ideal for us as healthcare providers. And as you well know, the burnout rate in primary care is high. And so we wanted to create an environment that was welcoming both for our clients and for our healthcare providers, our nurse practitioners, and the rest of the clinical staff. And so we'll be talking about what some of those components are as we move through the presentation here. But I pulled out some statistics recently that are fairly compelling, I would say. And so, in terms of some of the reasons why is there opportunity in primary care? Well, there's currently a 25 to 35,000 physician shortage. So most of the research around this focuses on physician providers, and so that shortage is basically due to the fact that approximately only a quarter of medical school graduates are going into the primary care areas. So so there we have a shortage on the supply side for providers. Another stat that came out just recently from the Bureau of Labor Statistics, and I'm reading this because I just found it today. The occupation with the highest projected percentage change in employment in the U.S. between 2021 and 2031 is a nurse practitioner, and that's just from the Bureau of Labor Statistics. And so they estimate that NPs will grow by 46% during that period, from 246,000 or so to 359,000 nurse practitioners. So as we see the decline in medical school graduates going into primary care, significant shortage on the physician side in primary care, we're seeing an uptick in a significant growth in the role of the nurse practitioner. And most nurse practitioners, the greatest percentage of nurse practitioners go into primary care services. So challenge and opportunity there. And and the other things that, again, I said that, the primary care, or the value of primary care is fairly non-controversial. We're approaching things from a wellness perspective, prevention. That's not an original thought. That's not an original idea. I've been in nursing over 30 years. You can tell by the gray hairs. And this has been, an approach that philosophically has made sense for a very long time. We haven't done a great job in executing on the prevention side. And we really felt that by being very deliberate in our care model with prevention, that we can have a significant impact on individuals' lives, improving the experience of the care, and perhaps making that experience better, and maybe people would even want to come in to our clinics to see us, as opposed to just checking a box. And then down the road we can see, might we actually be able to affect outcomes? And so those are some of the underpinning reasons as to why we started with this model, some of the research behind where the challenges are in primary care at this point. So let's go on to the next slide.
Absolutely. And Kevin, and I just want to, I clicked a little too quickly. So let me know if you want to go back to the first
Oh,
innovation.
okay. No, you're good.
All right.
Thanks.
Okay. Hold on one second. All right. There you go.
And so another stat that I wanted to start with here, in terms of access. So there's the experience, and then there's also access. I've given lots of presentations on innovation in healthcare, and had been using a statistic that was getting old from 2017 on wait times for primary care visits. And lo and behold, this group, Merrick Hawkins, came out with the latest 2022 data talking about the average. And again, they looked at physician wait times in 15 large metro markets. And in 2022, the average in these 15 markets is 26 days to get an appointment with a primary care provider. And that's an 8% increase from the data that I had been previously using, a 2017 survey at a 24-day average. And then in 2004, it was 20 days. So the wait time continues to increase. So certainly there is a challenge on the access side too that we hope that we're addressing with our clinics. And in terms of the importance of primary care, just a few more points to touch on here. As you know, with nursing, we have a very strong focus on patient education, and our appointment times average about 39 minutes. We offer appointments that are 30, 45, and 60 minutes, and we really feel that there's value just in having more time with patients. It's a better experience for them. And again, getting back to the perspective of improving the experience for our providers too, for us, it is much more satisfying to be able to address an individual's needs as opposed to rushing to the next patient and hoping that that person who you didn't get to talk about those four other things that you wanted to talk to them about will come back, and over time that takes a toll on us as well. So by having the longer appointment times, it really creates a better experience for everyone. And again, the statistics around individuals who are regularly seeking primary care services, it really does decrease the morbidity and mortality for a host of conditions, reduces ER use, and obviously prevention and early detection. Those are all very important components of the care that we provide. So from here, we're going to make a little segue, and Sarah's going to talk about more the clinical perspective and the services that we're offering. Then we're going to talk a little bit about some of the design aspects of our clinic, and we've got a couple design gurus or nerds, if you will, with us today, and hopefully some more. And that's a big part of how we're creating a different experience as well. But let's start with the clinical services. So you can go to the next slide.
Yeah, thanks, Kevin. So you mentioned access, and it looks like we kind of hit a hot button topic there. I can see people commenting in the chat about how long patients are needing to wait, or as we would call them, clients are needing to wait to get in to be seen for primary care. So access, let's get into a little more detail about access for our clinics. So the goal is really to have clinics that are located geographically in convenient places for patients or clients. And so most of our clinics are located in high traffic areas. So the main level, if you will, of very busy apartment buildings or next to retail that's accessible to folks. So they're seeing our advertising, they're seeing the clinics as they're going about their normal daily business. For example, the clinic that I practice in is located directly across the street from a daycare. So several times a week, we'll have clients come in and say that their children go to the daycare right across the street. They have this or that issue going on, and it was very convenient for them just to pop in the door here and start their care with us. So the access, the geographic access is one piece. Design is another piece, and as Kevin alluded to, we'll get into that in more detail here in a minute, but several of the clinics have 4, and we call them consult rooms, not exam rooms, because again, we're trying to use terms that are friendly to patients or clients. Some have 4 consult rooms and some have 6. And the size of the clinic is relative to what we think the traffic is going to be at a particular clinic. The expertise, let's move on to that piece. Expertise, all of the clinics are led and staffed by nurse practitioners, either doctorate in nurse practice or master's level folks, of course. We also have support staff, so we call them a clinical coordinator, a CCC, a client I'm going to
Client care coordinator.
Client care coordinator, yes, CCC, we call them in the clinic. They're the front desk folks, if you will, commonly doing those front desk tasks of checking a patient in or a client in, getting the insurance information, and then all of the demographics information from a client. And then we're also supported by medical assistants, LPNs, and or RNs. And we really are a team. As you'll see in some of our design slides, we all sit very closely together so we can hear what's going on with one another, and really support each other in practicing at the top of our roles and the top of our license. Let me see, what else do we want to say here? We offer some regular, under the expertise heading there, we offer regular educational sessions for patients, whether that be one-on-one when we're coaching them, and then some public education as well. So I don't know, about a month and a half ago or so, we had one of our experts presented on long COVID, and that was open to any of the patients at our clinics to be able to attend those that educational experience. We meet patients where they are. So with the convenience piece, we might be talking to someone on the phone, we might be doing a video visit with them, or certainly seeing them in person in the clinic as well. Along with the meeting them where they are, moving on to more the personalized experience for folks, we start all of the physicals. So if someone's coming in for an annual physical or a wellness planning visit, we start those visits with the PAM, so the Patient Activation Measure score. So they fill that out for us, and right away we know how engaged is this patient in their care. Where are they at with being able to formulate goals? Do we need to start more basic if they're scoring a 1 on that measure? Or are they pretty engaged in their care already? They come in with a huge long list of questions that they have, and they've already looked at the literature or already Dr. Googled and have many questions for us. So based on what that score is, then we factor that into the conversation that we have with them, and then later on when we're talking about setting goals together. You can go to the next slide. So this is just kind of a high-level overview of some of the services that we provide. And we're definitely trying to provide, I think what sets us apart from many primary care services is we're really trying to provide that same day or next day service. And clients will often comment on that. Oh my gosh, it was so easy to get in. I'm so glad I could be seen today for thus and such. So again, that's definitely a comment that we hear related to the access and related to that experience. So we do a fair amount of preventive care, definitely behavioral wellness, as we all know, especially with COVID. That has been a huge area of concern and a huge request from clients to get in to be seen for those kinds of issues. We do a lot of chronic disease management, and thank goodness for connected electronic health records, right? Now we can see folks' history from most of the major organizations here in our geographic area, and even from areas that are a little further out. And then I think another thing that kind of makes us unique is because we are fairly small clinics and we're all working together, it's fairly common that we'll request medical records, historic medical records for a client, and those are returned at lightning speed oftentimes. And I don't know, I would chalk that up to really excellent MA and CCC support. They're really on top of that. They know how important it is for us to know the history on clients, especially as it relates to the chronic disease management. I think in my past practice, we would request records for a patient or a client, and then maybe 2 months later, they would come to my desk, and then maybe I would remember why I had requested those and why I needed what I needed to research. But again, that turnaround with the records is very quick, especially when it's electronic. We see folks for immunizations, of course. Just got our new bivalent COVID vaccine in today. So that'll be a hot offering now. Men's health, we do overall skin checks for folks, do some biopsies if needed. Talking to teenagers about, we do see ages 12 and up. We should have said that earlier. But as you can imagine, lots of acne visit requests. Talked about the virtual care already. Wellness planning is a pretty unique offering that really sets us apart, and I'll get to that more on the next slide. But then just finishing up with women's health. And especially menopause. We are finding there's a huge demand for women to talk about menopause and to learn about menopause, and lots of requests for lab testing around menopause. So those are all in our bag of tricks as well. Next slide, please. So talking in a little bit more detail about this wellness planning visit that I kind of alluded to. First and foremost, we set out to co-create a plan with a client. We're not directing that plan. We are simply sort of the advisor on that plan, or the consultant on that plan. So folks will come in for a wellness visit with us, and this is can be part of a physical, but oftentimes is separate and unique from a physical. We will talk with them about the 6 pillars, and these are related, taken directly from the American College of Lifestyle Medicine. A couple of us on staff are lifestyle medicine certified, and really using that holistic approach to look at a client, to talk with a client, and then to formulate the plan for them. So looking at the areas of nutrition, and we like to say whole food plant forward, not plant-based. Sounds a little bit pushy, especially for somebody who's probably been eating meat most of their life, or grew up on a dairy farm or a hog farm, whatever. So plant forward is the term that we use. Physical activity is another one of those pillars. Avoidance of risky substances, restorative sleep, and then social connection, which we all know is so vitally important to overall. All of those pillars are equally important, but especially that social connection piece. Then after we've talked with the client, interviewed them, there's a large tool that we leverage called an in-body scan. So it's a machine that a patient stands on, and it really gives us a very detailed reading of where they're at physiologically. So things like body mass index, obviously their muscle weight, their intracellular and extracellular fluid weight, all kinds of detailed things. And it's really interesting. We, as I think, curious and interested providers, love that level of detail sometimes. And we might offer that up to a client, and they may say, I'm not ready for that level of detail. I'm not a numbers person, or I don't care to know that level of detail. Or sometimes we're working with a client who has a history of body morphic disorder or eating disorder. And that can be a trigger for them, seeing those kinds of numbers, i.e. things like the basal body mass index, or how much fat mass they might have. So it's really working with those clients and listening to them and hearing what they're saying and gauging, again, their readiness and what's going to work for them individually for that conversation. We're also drawing some labs at that visit, some basic labs that we would normally draw for a physical as well. So we incorporate both of those sort of more quantitative kinds of information, along with the qualitative information that we're gathering in the interview and during our conversation with them. Then we set out to establish some SMART goals, so specific, measurable, attainable, help me out here, R&T timely, and so setting out to develop those goals with them. And again, sometimes some clients come in and they say, I have 6 goals or 7 goals that I want to accomplish, and it's all around exercise. And it's really coming back and saying, let's make sure they're, in order for these to be attainable, maybe we should shoot for 1 or 2, kind of depending on how the conversation has progressed and their readiness, and then again, those more quantitative kinds of results. So sometimes just bringing a little bit of reality and setting them up for success with 1 goal or 2 goals that we might revisit 3 months later or a month later. And then so getting to that piece about the information that they're getting and then the summary that we're giving them. So at the end of the visit, we formulate the goals together, give them any handouts, or can email those to them through the portal, through the electronic health record. And then talk about any follow-up. So they can schedule the next appointment through the portal. So that's really negotiable between them and their provider, whether they want to come back in a month to check in, or if they want to come back more in the 3-month time frame, especially if they're looking to decrease their lipid levels, or really embark on a exercise program or changing their nutrition a lot. Maybe they want to wait 3 months, because we wouldn't see those changes probably until the 3-month mark. So. Or if they want to schedule before they walk out the door, we can certainly help them out with that too. Next slide, please. The other thing I should have mentioned on that slide is we invite them to contact us via the portal. So, as we're kind of tying up the visit and kind of coming to closure on that visit, we'll say to them, feel free to message us in the portal if you have questions after you leave today, or if you think of something else, or you look at a resource and you want to know what we think about that resource, feel free to message us on the portal. And I think as providers, we've kind of all been afraid of that in the past. Like, is that going to open the floodgates? And now I'm going to be so busy answering portal questions that I won't even be able to, see the patients that are here to be seen for their visits. And Kevin and I have both lived in the informatics world and tried to stay somewhat up on the literature, but we know from looking at that literature that that's not the case. If we talk with clients, give them the opportunity to answer or ask and have questions answered to their satisfaction, they may ask us 2 or 3 questions through the portal in the coming week or so. But after that, there's a point of satiety. Their questions have been answered, and now they can kind of go about their goals without our close shepherding.
Yeah. And I think this is a great description of the wellness planning visit and some of the feedback that we have received from clients. So this is a very specific visit. This is different than coming in for a routine annual physical, which oftentimes is more of a checkbox kind of visit. This certainly can include similar labs and evaluation that you would have at an annual exam. But the wellness visit is focused very much on the conversation with the client. And it's interesting how, even though they know that they've been scheduled for 60 minutes, they're surprised that they still get to keep talking. Sarah's not getting up and going to the door or going to interrupt and start doing the exam. And depending on the individual client, that full 60 minutes sometimes can be mostly talking. And so part of the wellness planning is not just that one and done visit, but really creating, and this is very nursing, a plan of care, right? A care plan which would be sequential visits and mapping that out. And Sarah referred to the PAM score, the patient activation measures. So that really does help to guide how we approach that individual. So if someone with a PAM score of 1 does ask to work on 3 things, we're probably going to narrow that down more for that individual than we would for someone with a PAM score of 4. And we don't have time to tonight to talk about all the details of the patient activation measures, but it is a validated survey that really does help guide how you can approach the individual client to be effective in your care planning. And the other piece, to go on the meeting them where they are, is that conversation about prioritizing, because we're really good at managing numbers, right? And we find some satisfaction with that too. But are the numbers that we want to manage important to that individual? And so we might start at a place that is different based on than we would in a typical practice setting, based on what those individuals' goals are. And I just can't help but make a comment on the in-body too, because it's just so interesting. So Sarah's comment, so I might not be ready for that. So some of our clients they want to train for it, right? I'll do it in a month after I've lost some weight, and so my percentage body fat can be a lot lower. But we're not pushy about that at all. It's another tool to get additional data that could help guide their journey to improved health. But an example of where it can be super beneficial, you have someone who does have weight loss or fitness goals, and they're kind of hitting a wall, and their weight and BMI is exactly the same, and they're frustrated, and they come in and we can show that their lean muscle mass has increased X%, and that's a win for that individual, even though that BMI and weight has not changed much. So so it's very comprehensive, and we do really look to the client to help guide the process and the experience.
Next slide, please. So this is a picture of one of our clinics, and just want to point out again, we call this the welcome area. We don't call it the waiting room. So it's the welcome area, and the intention is to be very welcoming to clients. So Kevin, you want to add a little more?
Yeah, and so again, Sarah mentioned that our clinics, they have 4 or 6 consultation rooms, so we don't really need a large area, and the appointments are 30 and 60 minutes. So we really don't need a lot of space for individuals. Our goal is for our clients to not have to wait, and if they do need to sit down and do some check-in on a tablet computer, that they have a comfortable environment where they can feel more relaxed. It doesn't look like a typical clinic, or heaven forbid the DMV waiting room, and just really make it much more welcoming. And in the early design phase, we even considered a self-check-in approach and sort of the anti-waiting room. So we have a welcome area. That's one difference from a typical waiting room, but we're even looking at doing self-check-in, where the individual could have check-in online and self-room. And there have been some studies that have shown fairly high satisfaction rates with that. We weren't at a point where we had the technology in place to really make that work. But again, we're trying to think, how can we really optimize this experience so that it is similar to experiences that we have in other areas of our life, and other retail experiences, or other experiences in other services out there.
Next slide, please. Couple things I want to point out on this picture. If you look over on the lower left-hand corner here, you can kind of see what looks like, well, some of us would call that a wine fridge, but it's not, it's water. So see-through glass, very purposely. We do try to offer folks a water, and it's interesting. People come in the door and the first thing they say is, "Oh, it smells so good in here." And we'll get to that in a second. But I think that's one thing that they notice. And then the other thing is we offer them a water. pretty much right away when they walk in, because people are running ragged, or maybe they've I don't know, come from dropping kids off at school and then another little one at daycare, and they're busy and they're barely getting here on time. And so just that kind gesture of offering a water really kind of sets the tone early on. The other thing I want to point out in the picture is you can, just above the fridge there, you can see, and it's see-through so that people can help themselves as well. Up above that, then you can kind of see we have some curated books. We've got those above us here too. So things like the Blue Zones solution, a book on Mediterranean diet, various books that we've curated and believe might be helpful to clients. Then we have supplements, which again is very different to see in a traditional clinic, but we do leverage a fair amount of supplements with our clients when that's appropriate. And then you can't really see them very well, but essential oils are another thing that we integrate into our practice as well. Do you want to say anything about this one?
Well, I just a comment on the supplements. So part of the wellness visit, Sarah mentioned those pillars of that we focus on, and nutrition being a big one. And certainly, if an individual is eating a perfect diet, they probably don't need supplements. But we do a detailed dietary history, and then for certain individuals, we'll do labs that are specific to nutrition and offer supplements. And so even though we do have them available for purchase in the clinic, we also encourage them to, if they are interested in taking supplements, to find any source that is most economical for them, and we have lists of supplements that meet the consumer labs standards, and so the line that we carry meets all of the highest standards of quality and potency, but again, our goal is to guide them on that journey, and they're right here, and we can talk about that with them in the clinic and show them examples. All right, I think we can go to the next slide.
Oh, good. On this slide, there's a picture of our diffuser. So right above the fridge there, down in the left-hand corner, we have diffusers in the clinic, and that is the root of clients walking in and saying, "Oh, it smells so good in here." So again, just trying to make the whole experience more calming, more peaceful, less stressful, different in another way.
Do you have a favorite essential oil that you use in the diffuser here?
I love thieves.
These, yeah.
Yeah. But sometimes we get crazy and mix them together too.
Oh, yeah. Mixology with essential oils.
Yeah.
And so it does not smell like rubbing alcohol in these clinics. So I can guarantee that. All right, next slide. This is what we call the hub and the work area. So in the foreground there, you see a countertop, and that's used for impromptu and formal team huddles, and that works really well. And there's also some great storage. And then we have the workstations in that central area, and then on the sides you'll see that the consultation rooms are on the perimeter there, and if you look straight across in the middle, you can probably see that the door is actually a sliding door, and it again, it's a design consideration. It's really kind of cool. They're very, very nice doors, but it's also it has screening over it, but it does allow some light to come in, so it's not real dark. And the top, there are clear windows on top, so we try to get as much natural light to come into both the workspace and into the consultation rooms as well. And you're probably we're using a wide angle lens in these photos, so it might be hard to appreciate proportions, but the ceilings are much higher than you would see in most clinic settings. So it really has a spacious and open feel. And again, that's to create a sense of comfort and spaciousness. And we're able to do that even though our clinics aren't huge.
I would just comment on two things here, and I just kind of experienced this the other day. I had a little person in clinic with a mom, and found out that these sliding doors are very useful with little people just because they're fairly heavy, so they can't move them very well. So if you're looking to corral a child and keep them in the exam room and not opening the door all the time, these actually work very well. The other thing I want to mention is I think a learning for us was the natural light is beautiful, but when the sun is shining right on your computer screen such that you can't see what you're supposed to be doing, then we had to come up with some tricks for that. Yeah. So various kinds of shades and window coverings that you can see here. But again, just living in the beautiful natural light every day does your spirit quite well as a employee. Mm-hmm. So,
all right, you can go to the next slide. And so here's just another view of the workstations. And if you look straight across, so this is a slightly different layout of workstations compared to the previous slide. But if you look, as if you're sitting in the chair looking straight across, you can see that those consult room doors are closed. So and you cannot see into the room, but again, you've got the glass above, and some light does filter through the glass on the door and the panels on the side as well. And for the clients to see real people doing real work is we think adds to the welcoming atmosphere.
And again, the ability to hear each other. So, we can hear what our nurses are saying. We can hear what the CCC is saying in some cases if they're sitting in the back with us here. We can hear when clients call in kind of how they're being instructed, or if we know that we're going to have to pick up the phone and respond to something instead of going right back into a consult room. We're kind of very aware of what's going on in that space. So that's helpful. Next slide, please.
All right, and so from a design perspective, this is where the consult rooms is an area where we put a lot of emphasis and focus, and it was really exciting. The whole project, but in particular for me, the consult rooms were this design was really fun. Starting with a blank sheet of paper, working with an architect with significant experience in innovative design for healthcare, large systems, wayfinding to rooms and welcoming spaces, working with design folks and also with a branding agency, and they were very very much involved in the aesthetics, and we really wanted to think about how do we want this space to make people feel, and what is it about the current status quo that we could improve on. So one very basic thing, most consultation rooms are somewhere around 100, 110 square feet, and ours are probably average about 135 square feet. So they're and you feel it when you walk in, right? That it is a larger space. Again, the higher ceilings, the natural light coming in, it's not claustrophobic. The other piece is, and it'll show a little bit better on the next slide, but I'll just talk about it here a little bit, is that you'll see that the exam table is adjustable height, but it's regular, its default position is at chair height. So when you are working with them, if you, as the provider, are in your chair, you're at eye level with them, and that was a very important aspect of this design. And I'm just going to jump ahead because this one in this image you can see the printer. So thinking about convenience for the provider and the client too, how many times have you printed out some patient education materials and said, I'm going to go out in the hall and get it? So either you go out in the hall and get it and break up your visit, or you say on the way out, I'll grab it off the printer for you, and you forget. So it makes it very, very interactive. You're able to provide that patient education material in real time for them. Anything you want to add?
Yeah, the other thing I would comment on this picture is the desk. So the workspace, we invite the client to just sit wherever they want to when they enter the room, but eventually when we start talking with them, we'll ask them to come on over and have the chair right beside us there. The desk is trapezoidal shape, so it really does lend itself well to, number one, just being comfortable to sit at. And then secondly, for really partnering with the client and showing them exactly what you're doing in the electronic health record. So whether that's, reviewing history with them, what's really impressive is when they they do self-check-in online at home or out here in the lobby in our clinic, they go through a lot of work to submit that information. And many people, that's very important information for them to share with us. We can reconcile that information and then just show them right there on the nice big screen. Thank you so much for sharing that information ahead of time. That's really going to help our conversation today. And let's just double check. Oh, looks like your mom had breast cancer. Is that true? Just honoring what they've already input and then showing that you're actually aware of what's in their information. And then them being able to, point to various things on the screen or just really support that conversation that we're having with them.
And thank you to the commenter who pointed out the glove boxes are recessed into the cabinet. Thank you for pointing that out. And that's one of those things where I believe this one is small, medium, large. We had multiple designs that started out with large, medium, small, and there were many different iterations. But that was part of the learning. But again, the look and feel, we wanted to be very clean and not cluttered, and I think we've accomplished that. And compared to experiences that I've had in primary care, where above the computer screen, above the sink, you've got 8.5 by 11 pieces of paper that came off the computer 6 months ago, or maybe 3 years ago. They're taped up with Scotch tape and are dog-eared, and they have highlighting and words crossed out and corrected, and just seemingly inattentive to the feel of the space and the clutter, and so that was one of the considerations. We want it to be a relaxing space, not a stressful space. So if we go to the next slide, I wanted to continue on with what Sarah was saying about the desk design, and so we're seeing it obviously from the wall looking out at the desk. But again, that shape, the Mayo Clinic actually did a study on this, and it was a randomized controlled study with standard work surfaces that are at right angles and rectangle or square, or either a curved semicircle or this trapezoid, and this design creates the opportunity to make eye contact with the individual simultaneously with looking at the screen, or if the screen is off, you are in direct eye contact with them. In contrast to many standard clinic designs where you're at right angles, and you have to stretch to be able to look eye to eye with the individual, and again, being able to start with this blank slate was just so wonderful. Most clinics, if they've been built 20 years ago or more, were retrofitted to handle electronic health records. And I'm sure you have all had an experience either in your work life or as a patient yourself, where you're actually looking at the back of the head of the individual who's on the computer. I heard a funny story at a conference where a mom brought her daughter in to see the pediatrician, and they were back out in the waiting room. She said, "Why don't you draw a picture of your doctor?" And so her daughter drew a picture and showed it to her mom, and it was the back of the head of the doctor. And so that obviously is a less than ideal experience. So again, it's very collaborative, and I would have, if I thought of it in advance, included a photo more of the blueprint so you could get a top-down view. But much like kitchen design, this also has work triangles. So the clinician is going to be sitting on the side that's closest to the sink, and that's their work triangle. And whether they're in a chair at the desk, or whether they're sitting in the stool and performing part of the examination, or standing on that side of the exam table to provide the examination, they have this work triangle where they have access to all of the equipment. And so we have 6 clinics now, and they're all set up exactly the same. So if you open that top drawer on the left-hand side, it should be the exact same thing at this clinic that Sarah practices in, and the 5 other clinics that we have in the Minneapolis-St. Paul area.
Which is very helpful if we have to float, or when we float.
Mm-hmm.
Yeah.
And we do have another exam table model that we use in most of our clinics. That is more of like an exam recliner, and that is really very comfortable for our clients as well. It doesn't work for all exam types, or clinics typically have a mix, but they all have the ability to be at chair height, so they're not having to step up to get onto the exam table. And then obviously we have the electronic controls to adjust for the height for the provider.
Next slide.
All right, so this shows our clinic locations. Our first clinic opened in late January, early February of 2021, and so we weren't planning for that to be COVID time. So the whole planning process for the Good Clinic was over a course of a couple of years. And so we opened our first one in like I said, January, February 21, and then the second in September of that year, and then in the last 3 months of 21 we opened the others. So we have 6 total right now, and we'll be opening at least one more in the Twin Cities area this year.
Next slide, please. So of course, we can't do the presentation without bragging a little bit. So we are very proud of our ratings on Google and ZocDoc, which is, for those of you who don't know ZocDoc, another way for excuse me, clients to schedule online. But 5-star ratings across the board, so we're pretty proud about that. And we just wanted to pull out a few things that we hear quite a bit from clients. And I would say that they comment often around the amount of time that is spent with them. The other common theme is they feel heard. They feel like someone finally listened to them after oftentimes many years or many different providers that they've seen to talk about a specific issue. They just feel like they were finally heard, and testing was done or options were offered that they probably hadn't heard before or didn't even know exist. I think another thing that we experience is I was talking with a menopause client the other day, and she was talking about how she was feeling. And many of the symptoms obviously were physiologic, but many of the symptoms she was talking about were more behavioral health, or she was talking about a lot of irritability, depression, and we just started talking about that's part of the normal progression, or those can be symptoms of menopause when you're starting when you're starting the menopause journey. And she was shocked. I wasn't, because I try to keep up on the literature, and NOMS, the North American Menopause Society, just published a pretty good article about mental health during menopause. And so we were talking about that, and she was shocked that that was actually part of menopause. And we spent a good amount of time talking about that, and then coming up with some ideas for how that fits into the whole picture, and then what we might do to sort of ease some of those concerns that she was having. So again, I think it's difficult to get to that level when you only have a 10 or 15-minute visit with a client. So again, the time, the listening, the ability for us to hear, and then kind of a fun one is accessibility of the providers. So today, my partner picked up the phone rang, and she picked up the phone, and the client said on the other end that my partner answered with her first name, and the client on the other end said, "Oh, so-and-so, you're exactly who I was looking for. I didn't know that you answered the phone there." And it's like, yeah, we do. We sometimes do it all here. And we are very accessible to our clients, whether it's via phone or, as we've talked about, through the portal as well. So anything you want to share about consumer satisfaction?
Yeah, and just to that point too, the philosophy in the clinics is that there's no job that's under us. To Sarah's point, answering the phones, helping check, if the medical assistant or nursing staff is busy, we're all willing to just jump in, and our clients notice that too, that there's really that teamwork. I would say, just comment on the online ratings, and it's one of those things that for many of us, online ratings are a blessing and a curse. And it has been so gratifying to see the reviews, and not just that they're positive, but the specificity of what it is that they like about the Good Clinic. And to Sarah's point, the time that is spent with them, and that's such a huge factor, because they're able to go down a layer, and you're able to talk about things that are important to them. And again, sometimes it's even disarming to them. It's like, wait a minute, I get to still keep talking. So that's what they're saying in the reviews, that they're being heard. And also to go off what Sarah was saying, the behavioral health is part of everybody's health, and to be able to incorporate that into every visit. I mean, obviously, we do the PHQs and the GAT-7s, and that, that's one component of behavioral health. But it's also important to really, how are they doing? How's your sleep? What's your stress like? And so that's where a lot of the specificity in the comments is that, nobody's really asked me those questions before. And I've worked in those clinics where you don't have time to ask those questions. And there are wonderful people doing wonderful things for the patients in those settings. But there is another way to do it. And our clients are telling us that we're meeting that need, and they're even surprised that this option is out there. So to hear them tell us that we're being successful at what we set out to do is really quite gratifying. End of brag.
Yep, end of brag. Next slide.
So it's not all roses and sunshine, and we have our challenges too from time to time. And we consider ourselves to be a learning organization. And from an organizational standpoint, input from all staff, all nurse practitioners is part of how we're continuing to learn and grow and evolve, and that's a really important part of our culture as well.
Well, Kevin and Sarah, thank you. I mean, such an incredible presentation, and I don't, seeing some of the chat conversations and questions come through. People are noting beautiful model, amazing to see this approach in primary care, and achieving these ideas based on holistic care and models that include wellness, emotions, coaching, and so much more is innovative. That these concepts are not new to nursing, right? But actually being able to deliver on those is really what we're hearing from Darlene in that comment. So a lot of appreciation and excitement around the model, heartwarming. But there are some additional questions too. So,
Sure.
in the comments, people have been sharing that 2 to 3 months in multiple areas of the country. Sarah, Diane, and Darlene all shared 2 to 3 months feels kind of normal for where they're at around delays and waits. And, even with some of those open scheduling slots for same day appointments, but, those are getting filled quickly. There was a question around board certified nurse coaches. Are you using coaches at all in any of your sites, or are staff really, it sounds like staff to some extent might be filling aspects of that. Curious what your thoughts are.
Yeah, it's we're not incorporating coaches at this time. It's something that we've certainly talked about. All of our nurse practitioners, come to us with their experience and education in patient counseling, in patient education. We do have formalized orientation modules on specifically around things like nutrition, stress management, sleep, and multiple topics that are like refreshers, so that we all approach this and are essentially on the same page. But thank you for that question. I think that's something where there could be value in this model, where when Sarah's schedule gets so busy that visit 2, 3, and 4 for that wellness planning, some of those visits could be managed by a coach.
Mm-hmm. And lots of other questions, but in my trigger happy, mouse clicker finger, we scrolled through your photos a little too quickly, but both of you have unique backgrounds that led you to this work. And Kevin, are you able to share a little bit of your background? And because you both talked about having that exposure and background to informatics, but just for those in attendance, for them just to hear a little bit about your journey too.
Yeah. So my nursing career on the RN side was in ICU and emergency care, and I became a nurse practitioner probably 3 years after I graduated from my BSN. It was something that I just really wanted to be in primary care. And so I have worked in family practice. I've worked in some specialty. I worked in a specialty practice, a spine care clinic for several years. Have been in leadership roles in most of my positions. And it was when I was in a faculty practice role. So I also taught at the University of Minnesota School of Nursing nurse practitioner program, and my faculty practice was at a family practice clinic that's part of a large system here. And one of my physician colleagues came to me and said, I would like you to meet with me and an entrepreneur who has an idea about nurse practitioner clinics in retail settings. And so that was 1999, and that was the start of what was Quick Med at that time. The nurse practitioner run clinics in grocery stores and pharmacies, which a few years later became Minute Clinic. And what really excited me about participating was that there was a mission, and the mission and the goal was to make access to care easier. And so the focus, at least the entrepreneur's problem that he wanted to solve, was on the access side, and the fact that he could not get into family practice or a pediatrician on evenings and weekends when his child had a sore throat or an earache. And so the concept of consumer-centric healthcare was very intriguing to me, and it also kind of cut against another focus of mine, which was continuity of care and primary care. But as we've evolved with consumer-centric healthcare, we should really be able to be the boss of our healthcare, right? And so that really resonated with me. And I had so many amazing experiences on that journey, and became very interested in informatics, going through the process of helping to design an electronic health record. And we built our own EHR that from the year 2000 until I think 2018 was completely functional. And 15, well, there were probably 1,000 clinics at that time. And so there was a lot of learning. And so I went back to school and studied informatics. As a matter of fact, Sarah and I rubbed elbows in the same program for informatics at the University of Minnesota. And then that led me to another opportunity that was to help create a telemedicine platform called Hypnosis, and that was mentioned in my bio, and very much a cutting edge in a way for telemedicine, in that the foundational functionality was on asynchronous, which sounds very impersonal, but it's really to drive efficiency in overburdened health systems, so that things that are very transactional can be managed asynchronously, and there are many portal kinds of tools now that serve similar functions, but also we did have the full telemedicine functionality there as well, and then it just conversation with a couple of physician colleagues who I worked with before about this good clinic design. And again, as I mentioned in the introductory comments, we were sitting down looking at ways that we might be able to address some of the challenges in primary care, both on the provider and the client side. And so that is, in a nutshell, that was kind of a big nutshell.
Oh, and you've really been working on a lot of the edges early on, as we've seen some of these transitions in healthcare. And, I love that you've been able to take all of those different pieces and bring it to Good Clinic and your work there. And you mentioned in your services earlier that telehealth is also a service. What does that look like? I'm just curious.
I'll let you jump in terms of the experience, Sarah. But so this is so the early design documents were to have the Good Clinic very much focused on the option for virtual, asynchronous, synchronous phone, video, and then for many it was quite novel. For many providers, they were pushing back because I tried to convince providers to use telemedicine platforms, and in primary care, there's this thing called being one more thing to death. And every time you ask, okay, providers, you're now going to need to do telemedicine. You're now going to need to do this. So there was a lot of pushback. And then COVID hit, and all of a sudden everybody's using telemedicine. We weren't planning for COVID to happen in the middle of building this, and so telemedicine just became ubiquitous. And then as our clinics were starting to hit stride, clients were wanting to get back to face. So our original model that was going to be up to 50% virtual became mostly, probably 90% in person, because the individuals they were able to get back into the clinic and they wanted to get back in face to face. But if you want to talk a little bit about the virtual offerings and the experience, yeah.
So most of the time, if we're seeing a client for the first time, we'll ask them to come in person, but whatever is going to be most convenient for them. So it's interesting, most people will opt for a phone visit, and they will get an invitation through their portal account that, the visit has been set up as a phone visit, and that the provider is going to call them at the number that we have on file for them. And then the video visits show up in our schedules with a little icon in our electronic health record, and it's the entire experience is through the electronic health record. So we literally just click on that little icon, and on the patient side or on the client side, they have gotten a link in their portal account that they just click on that link, and then we join together and the visit goes forward. I would say that our current electronic health record, compared to others that I've used, it's either the cameras are way better or the pixels or something is far better. So if we're looking at a rash, or we're looking at some kind of skin concern, or even into the patient's mouth, if we're looking at a sore throat, the cameras are very good, and usually it's just a matter of directing the client, as many of you maybe do. Can you move the camera a little bit closer to your mouth? Can you open a little wider? Can you move it to the right or the left? Move the camera a little closer to your leg, or whatever it is we're looking at. But really, for the most part, again, I'm a tech savvy and tech lover, so I'm pro telehealth visits, of course, but clients seem to be very comfortable with it. Providers are comfortable with it for the most part. Hope that answered the question. If you have a more specific question, please ask.
Yeah, I noticed in the photos that you had cameras on the computers in the rooms, and so I was curious if those if you're utilizing one of those rooms as a video visit, or if that's done in a separate space or remotely.
All of them are set up for that. Yep.
Okay.
Of the
Nice.
exams. And then, of course, we don't have cameras or audio on the computers that are in the shared space, just because
Right.
that would be too disruptive. Yeah.
Yeah, no, that makes sense. So lots of questions. So I want to try to be respectful of all of the people who have lots of people want to know lots about the Good Clinic. So one of the questions, you talked about the body scan, you talked about the PAM process that you're utilizing with patients. So there was a question around, what's the percentage of follow-up appointments, around, after kind of that with the goal setting, does goal setting impact your follow-up appointments? What are you seeing in that space?
I would say compared to traditional practice, where I was certified in lifestyle medicine at that point in time as well. And we would try to schedule follow-up visits for folks after we had set the SMART goals around whatever, nutrition, activity, you know, decreasing risky substances, whatever the area was. And more often than not, people either canceled those or they did not show up for them. They no-showed. I feel like, just anecdotally, and we could look at this in our reporting as well, but I feel like most folks are scheduling those appointments because they're ready to make a change for the most part. And so then the follow-up is maybe related to they're just that kind of a person. They've tried other things and now they're really ready. They're at that level 4. You know, they're ready to make a change and ready to set some specific goals and work on those. So just anecdotally, I would say probably the in-body scans / wellness visits that I've done, I would say probably somewhere around 70 to 80% are following up.
Perfect. Well, Sarah, thank you. Thank you for sharing that. And, to those of you in attendance, if we're not getting to the depth that you would like, just, put a follow-up in the chat, but we'll keep moving through. So there was, question around, because of all of the services that you're offering, are all of your services covered by insurance?
Yes, so we're in network with the major payers in Minnesota. It took a long time to get there, but yes, and we also have a direct pay option for those individuals who are not who don't have insurance, and there is a percentage discount for direct pay, and we're 100% transparent with what our fees are for all of our services. We have handouts at the front desk for them, so they can see exactly what the services will cost. Yeah,
and that's a transparency and a trust building right there, right at the bat.
Yeah.
And I think to further go into a little more detail there, so many times the labs that are affiliated with the wellness visit will be covered by their insurance, but not always the in-body scan. And then the visit just kind of depends on the payer. But we are very transparent about that when we schedule it with them. We did a little promo, and I think we still have some cards for a free in-body scan.
Yeah.
But then being very transparent and clear with them about this is just for you to stand on that machine and for us to generate the information from that machine. That doesn't include your visit with us. And there would be an additional charge for that, and we tell them what that would be.
And I'll throw out another example. Earlier this year, we started offering pharmacogenomic testing for behavioral health medications, and some insurance companies do cover that, others do not. But again, we're 100% upfront about why we want to order that test and what the benefit might be and what the cost might be for that individual. So we don't like surprising our clients.
So for people who that might be new to, can you explain that test a little in a little more detail?
Yeah. The group, the company that we started a relationship with is called GeneSight, and they do genetic testing. They started out in the pharmacogenomics, and they offer a whole range of other genetic tests, but that's our focus right now, specifically for behavioral health type medications. And what this genetic test will do, it provides a very detailed report about an individual's ability to metabolize the various medications, and they cover anything that we would ever prescribe, and so the medications would and it's very visual. It's red, they would be a non-metabolizer. It's yellow, they may be a fast or slow metabolizer. Or green, they would be a typical metabolizer. And really, the benefit of that is that if you were starting someone on, say, for example, an SSRI, you would be able to rule out some agents right from the get-go, as opposed to the more traditional, try this medication for 6 weeks. If it doesn't work, please come back and see us. And as you are all, I'm sure, aware, the dropout rate on using those medications, the med recheck visits have a very high no-show rate. So this is an opportunity to really more quickly, hopefully, get to an effective therapy for the individual.
And again, just support in the chat around, would, liking, would they would like to see more people and providers utilizing tools like that. So, support from those in attendance. A couple of design questions. People wanted to know which was your first clinic and if all of the sites are designed equally.
Oh, okay. So, great question. So, our first clinic is in Northeast Minneapolis, and it's called our Nordhaus Clinic because it's situated on the ground floor of a very large apartment condo complex called Nordhaus. So that was our first, and it is a 4 consult room design. And so the way that the space is allocated varies from location, based on what's available. Sometimes we're moving into a space that had been something else before, and that makes a greater design challenge for our architects. If we're moving into a space like Sarah's clinic here, we're the first tenants here, and so we were able to really start with a blank slate and create this. So the layout varies a little bit, but the total square footage and all of the design elements and then the consult rooms themselves are exactly the same.
Mm-hmm. And with that, did you ever imagine as a nurse you would be in the design space?
No, it's so cool. It's really fun.
We have some nurse designers on the call, just
Yeah.
looking, seeing some of the names come in, but there are some nurses who are in the design space, so I'm sure they are loving hearing you.
And I'd
talk about this
love to hear from them. We're starting something. We know that there are opportunities to improve, and so as we grow, we want to iterate and learn. So I welcome any suggestions from you design folks out there.
And kind of again, kind of moving into some of the next spaces. So we talked about briefly with one of the questions around our services covered by insurance. There was a question around Medicare and Medicaid. So we know, right now that 40% of Medicare recipients receive care from advanced practice nurses. Are those services also covered within the Good Clinic?
Medicare, yes. We are still in the process of getting credentialed with Medicaid, but definitely Medicare, yes. Mm-hmm. Yeah, we do Medicare annual wellness visits as well as physicals and serve that whole clientele.
Perfect. Well, you guys are heading in a great direction, and some of the questions as people are looking at hearing your story and about the work that you're doing is really wondering a lot about the business model. So with the long appointments and current reimbursement, how have you navigated that space?
Yeah, I guess that's kind of important, right? You have to,
Yep.
it has to be a financially viable situation, and so the approach to the longer visits is primarily for the healthcare reasons that we think that we can provide better quality care, we can have better outcomes. The other piece of that is that we also think that we're going to have better retention with our clients, and that is where one of the big challenges in primary care is the churn, and you may have 1,500 patients on your panel that are attributed to you, but many of them are no longer actually actively coming in and seeing you in the clinic. So the retention piece is huge. From the billing perspective, with the updated billing and coding guidelines, we're able to bill on time, and so there are some advantages there as well. And then the other piece too is that we're starting here in the Twin Cities as the hub, and again we're learning as we go, but our ability to design and build a clinic gets cheaper every single time because we've gotten smarter, and in many ways, in terms of whether it's materials and furnishings and those kinds of things, and then we're centralizing all of the purchasing. And so there are significant advantages to that as well, and so again and then we will be expanding services. We'll probably expand to younger ages as well. We're at 12 and up right now, and we really think that there is a hunger for this personal kind of care, and so we think that we'll be successful because of that.
Well, I know I'm wishing that I was in Minnesota and had access to your services. Another business question for you. There was a question around business models. So kind of building on that first question, what's your plan for expansion, franchise, acquisition, co-locations? People are interested to hear what you guys are thinking and where you're going.
Wow, this is a very sophisticated group here. So our expansion plan. So, like I said, we'll probably be opening one more clinic in Minnesota this year. Our expansion plans for next year are being worked on as we speak for the next budget year. But we do have 2 locations in Denver that are initial construction has been started. We've had all kinds of challenges with supply chain and being able to get construction work and those kinds of things. Recommendation: the next pandemic, don't start a healthcare business. It's not great timing. And then we also have locations identified in Florida and Arizona, but in terms of when those will be built is still TBD.
Got it. Well, and again, just to make sure that everybody who has joined the conversation tonight, Kevin and Sarah are both making the presentation deck that they shared today available with you. So, if you want to see it in more detail, just email us at innovation at ana.org. So we'll make sure we get that. There was a quick question. Did you say you have something in Florida? So I'm not quite sure. Have a patient in Florida? Have a clinic in Florida? I'm not sure what that is, Kristen. Kristen also had an earlier question too, just to get to that. She talked about working within a model that was PA and nurse practitioner driven, where nurses were utilized to help facilitate within those sites. So curious if you've thought about expanding to add a nursing role with nurse practitioners and nurses providing care.
Yeah, we have, as a matter of fact, and we've started on that. So that incorporating RNs specifically was part of more of a long-range plan. We really wanted to get the clinic model set up figure out operations, workflow, those kinds of things, and then as we get busier, to incorporate RNs for more expanded roles and and being able to have more nurse-centric visits for certain kinds of follow-ups to support our nurse practitioners. As I'm sure you're all aware, the hiring anyone in healthcare is really a challenge right now. So looking at certified medical assistants and LPNs, it's really been hard to find candidates. So we expanded, and we've I think we just hired our third RN, and so they will be starting to incorporate expanded roles over the next year.
Awesome. Well, I mean, it's fun to hear that you guys are, what your future plans are, where you're building and growing to. People have some questions about follow up. They're excited about the topic and the work that you guys are doing. Is there a best contact person for questions? So maybe, Sarah and Kevin, if you guys can provide that to us, we can send that out with
Sure.
with a deck afterwards.
Great.
And if people have questions. But I just dropped a couple of questions into the chat. What did you appreciate about today's discussion, or how did the information discussed influence your thinking or feeling about the topic? And feel free to drop those in the chat. We'd love to share those with Sarah and Kevin. And we thank you so much for your time and the work that you're doing, and the innovation that you are bringing to your communities, and making sure that people are able to access care more readily. We're really excited, and this wasn't a part of our planning, our planned kind of conversation, but there is recent legislation that was just dropped. It was done in partnership with our legislators, but AANP, NA, and ACNS, and ANA all dropped the ICANN Act, which is really looking at how can we ensure full practice authority for advanced practice nurses. So we're really excited about seeing that work move forward. So if you are, as we look at the expansion of nurse practitioners being able to meet the needs in communities across our country, we will drop that link for the press release in the chat as well. But we want to make sure that's on your radar, because we would love to see work like the Good Clinic continue to expand, and having nurse practitioners and nurses be able to meet the needs of their communities. So to both of you, thank you. To everyone in attendance, thank you. And we'll transition to Lois for closing.
And I just wanted to just quickly thank you, Oriana and Lois, for including us in this presentation, and for the work that you're doing to shine a light on nursing innovation. And I just want to say that the participants, what an amazing group. I've been seeing these notes pop up on the screen. You're very interactive, and thank you for your attention and interest and questions. Wish we could have gotten to more of them, but thank you all.